The broadcast is now starting. All attendees are in listen-only mode.
Hey everybody, Drew McClellan here. Sit tight, it's a couple minutes before the hour. As you know, your compadres are often a bit tardy, so I want to give them a few minutes to get here. And then we'll sort of set the rules of the road and get started because I know you're anxious to hear what we have to offer. So hang tight, we will start shortly. Hey everybody, welcome to the podcast talking about the health insurance option. Sit tight, I'm going to give everybody a couple more minutes to show up and then we will get started. Hey, if you're just joining us, I am just treading water for a couple minutes to let more folks get in the room. So sit tight and we will get started in a couple minutes. Can somebody down in the chat window just let me know that the audio is clear and you can hear me? Okay, that makes me nervous. Hello? Yes, I have not gotten my flu shot. Thank you, though, for checking. But I'm going to get one, I promise. Okay. All right, thanks everybody for letting me know. All right, I'm going to give them about 2 more minutes and then we're going to get started. All right, let's get started. So here's how we're going to do this today. So very quickly, I'm going to introduce you to Allison DePauli and tell you a little bit about her, and then let her really drive the content of the webinar. And what I'm going to ask you to do is hang on to your questions until the end, because otherwise my fear is we won't get past slide 2. I promise you that we've worked hard to try and bake in the answers that I'm anticipating you're going to ask questions about into the PowerPoint deck. And Allison and I will stick around after the sort of formal presentation part. Once we get through the deck, we'll stick around and answer any questions that you have. I will say this, if you have specific questions like, I have a 55-year-old smoking cancer survivor of an employee, should I not bother? So if there's specific questions about your employees or the health status of your people or your agency's certain circumstances, we're not going to be able to answer those questions, and we certainly can't answer them publicly. So the next step for all of you is going to be to fill out some paperwork to sort of move this process along. As I think I've told you, our goal is that if we really hustle, some of you could be on the plan as early as January 1. So that's going to really take a lot of effort on your part, though, to move this along. But anyway, Allison is going to be available to each and every one of you to answer any specific questions you have about your workforce or your coverage or things like that. So today is really just about giving you the overview of how this group policy works, how you can customize it for your own agency, what are the benefits of us doing this together, all of those sorts of things. And then you'll have the opportunity to explore the specifics of your agency and what you can save with Allison. So let me just, so go ahead. If you want to punch questions in, that's fine. But just note, I'm not ignoring you if I don't jump into the conversation and ask them. I'm going to hang on to all of them until the end. So if you don't think you can remember it, feel free to punch, sorry, punch them in the question box now, but we will not dig into them until we get to the end. So, all right. So let me tell you a little bit about Allison. So Allison has worked in the insurance industry for most of her professional career. She spent almost 15 years at Aflac working with really being a consultative advisor to help big companies figure out how to do this. And at the end of the day, I think that's the takeaway for this, is that what Allison and her team have put together. And by the way, she's had her own company for the last 3 years. And how this all came to be is that I interviewed her for a podcast, which will air in early 2019. And I was explaining to her how frustrated I've been at trying to find a way for all of us to put together some sort of a group plan. And she said, I've got a solution that I think will work. And so several phone calls, lots of due diligence later. This is going to work for most everyone. It is not going to work for everyone. There are a couple states, and I emailed you, that are going to be problematic, and we will talk about those at the end. But we're going to have some sort of a solution, and or if we can't include you in our plan, a referral for you for everybody. And right now, this is a plan, or the policy build is a lot of chambers are using this. So again, sort of an association or a group plan. So that's sort of its origin. So what I'm going to do now is I'm going to hand over the deck to Allison and let her get started on the content. So sit tight. I have to change a couple buttons here. So. It's weird. The one person that it doesn't show that I can give it to is Allison. Oh. It's because all of a sudden she's gone. Okay, well, this is not part of the plan. I would sing, but that's not going to be helpful to anyone. I'm guessing she lost her internet connection, is on her way back. Hang tight. Sorry about this. Anyway, I'm excited about it. I think she's going to be able to save most of us anywhere from $1,500 an employee a year to a little more than that. So That should be some significant savings for most of us. Okay, well, this is problematic. Hang tight. I'm going to give her a quick call. She just sent me an email, said tech issue, give me a minute. So she's in Texas, so apparently they don't have good internet in Texas. So how you doing? No, I don't have any good jokes. Yes, there's a PowerPoint, but she has it, so you just need to sit tight. Another Texan says his internet is working just fine. Mark, I'm sorry about your exes. Yes, wasn't that a George Strait song? All my exes live in Texas. Oh dear. I don't know, Chad. What is a pirate's favorite letter? Oh, R. Someone guessed. Okay, that's painful. Several of you guessed. Yes, this session is being recorded, including all of these great jokes. So yes, I will send you all a link to the recording. Well, I'm actually. Somebody just said, "When am I traveling next? Can we wager on how late your flight will be?" I actually flew yesterday, and my flights were on time. So next weekend is when I travel next. I'm on the West Coast for a network meeting. Oh no, it's not R. All you people who thought it was R, it's C. The C. It's a clever little twist. Here she is. Okay, hang on. All right, so now I am going to share with Allison. All right, Allison, so we should be seeing your deck pretty soon. We're waiting to view your screen.
There you go.
Okay.
Can you see it?
Yes, we can see it. So we've been telling pirate jokes in your absence, so we're ready to talk about health insurance. Allison. Seriously, Allison, you there? I see her screen. Don't you guys see her screen? And I show she's still here. Okay, I'm not repeating that joke, Elton, but thank you. There she is. Allison, can you say something so we can make sure we're hearing you?
Hey, can you hear me now?
Now we can, yes.
Okay, we are having a problem in our building.
Okay.
So bear with us.
Okay, here we go.
Can you see it?
Yep, we're ready to go.
Okay, so is this you? Is this how you feel about healthcare costs? A lot of my clients are having challenges, and as you know, as a small employer, it can be a particularly challenging thing to deal with. You don't have a lot of choice, you don't have a lot of flexibility, you don't have a lot of knowledge about what is driving your cost. right? I get a lot of this. You feel like nobody's on your side. So we work pretty hard to make sure that make sure you have all the information that you have so you can make a decision that's good for you and your employees. So how do you know you're in the right place? If you're a small employer looking to do well by your employees, if you struggle with benefit price increases every year, if you've had to keep shifting more and more cost onto your employees, I know most of you know that doesn't work very well. You functionally uninsure people on a regular basis, which I think nobody wants to do. And if you're looking for solutions that you can afford and will help you attract and retain employees, this is going to give you some information and a great place to start. So, can you all hear me now?
Yep.
Okay, let me start by dropping the jumbo truth bomb. Insurance companies are not in the business of helping you. They're in the business of making more money every year, and I'm going to show you how and why that happened in just a second. So everybody acts like there's nothing they can do about the rising costs. They feel very badly about it, and oh my gosh, this just happens, and we don't know what to do about it. But you know what? That's not true. So in the next 60 minutes, we're going to change how you think about benefits, and we're going to show you how large corporations buy benefits and control their costs. I know that you're going to have a lot of questions. So as we go through this, these are some of the questions that we're going to answer. Who is the insurance through? So first off, the company is called Medova. Will my people's doctors and preferred hospitals accept the insurance? I think so. We are going to access the largest nationwide network called PHCS. How will this save me money, both in initial premium and renewals? We'll get to that in a second. Is this any riskier to my business? No. What if I have employees in other states? We'll talk about that in a few minutes.
I'm guessing this is not just a pregnant pause on her end.
More detail?
We lost you all of a sudden. We lost you after other states.
Okay, so is there more administrative work on my end? Little bit, not much, and we've worked hard to limit that. And are the rules of the road the same as with my current insurance? Mostly they are. Will I be able to control which plans I offer and how much we pay per employee? Yes, you will. Do I have to wait until renewal, or can I change at any time? Many of you are going to be renewing right about now. So this is a great time, but no, you do not have to wait until renewal. So the problem. Ta-da!
So, hang on a second, Allison. Another question that somebody sent me by email that we didn't have time to add to the deck is, will this cover same-sex partners, domestic partners? And the answer is yes.
Domestic partners of the same or opposite gender.
Yeah. Okay.
Okay. All right. So the problem is some of the rules of the Affordable Care Act. There was a really good intent to make sure that employees were protected and that their premium dollars were actually going to pay premium. So the rule was 80% of your claims dollar, or 80 cents of every dollar that you paid in premium, had to go to pay for actual claims. Now, in theory, this is great, right? The reality is the first year, if your spend is $100,000, and for a lot of you, it's more than $100,000, that's $80,000 in claims and $20,000 in administrative expense. Well, year two, with a typical increase that many of you face, 15%, that's $92,000 in claims and $23,000 in administrative expense, and so on and so on and so on. There's not a lot of end to that. So let me tell you how that happens. Can you all still see my screen?
Yeah, but okay, now you go.
Okay. I'm really sorry. There's some construction outside and it's apparently not a good day for the internet, even though it was working fine earlier. All right, so there are two large problems with healthcare. The one that people are hearing about quite a lot is the problem with pharmacy and pharmacy spread and where the spread profit or premium or extra cost is going. So I'm going to use metformin as an example. It's a common diabetes drug. A 500 milligram tablet for 30 days on the generic version costs $6.50. The 1,000 milligram tablet for a 30-day supply can cost $7,000 per month. There is no difference in the quality of the drug, just the cost. So what happens to the spread? It goes anywhere but to the payer. And most employers are payers of care, except for the out-of-pocket, which the employee picks up. And that's getting worse and worse every year. So what we've done is use tools to control the spread. And we'll talk about those in a little bit. The other problem is the actual cost of care. Depending on where you go, the cost can vary dramatically. So I'm giving you an example here of one of the tools that we use. So we have a repricing tool that will literally take repricing data from all across the country and give a comparison of cost and quality metrics. I'm all for cost containment, but frankly, if you don't have quality in your plan, you're not doing the right thing. And you're not doing the right thing not only for your employee, but for your plan as well. Typically, what we find is that the highest quality care is near the bottom of the price ladder. In this case, this is an actual employer in Indiana, and the codes are for some heart procedures. You can see the 551-552. The best quality care was $110,000. And where most of this particular employer's employees went to have this procedure, it was $247,000, and the outcomes were not as good. So we use tools to make sure that you get to the best facility for quality care. Now, finally, there is a solution for smaller employees. Larger employees have been using these tools for years, and they've been getting better and better in the last couple of years. Finally, with the advent of association health plans, we can offer this type of strategy and cost containment tools to smaller employers. And now that association health plans are valid, we can offer that to many, many small employers and still control how the tools work. So, just as a quick refresher, small employers used to have two options, fully insured or self-insured. So fully insured means that you pay your premium every month and your obligation is complete. You have no idea what is happening in the plan, and it just kind of increases and does what it does. Self-insured typically means you have a fair amount of administrative work and fluctuating monthly costs, which can be a real challenge for a small employer, and you have to manage all the tools. So now there's a third choice.
And the biggest thing is, from my understanding, is that if your folks exceed how much money you've budgeted, you're on the hook for the difference, right?
There's always something called reinsurance built into the plan, but when you're self-insured on your own, the reinsurance deductibles, we call that a specific, are generally much higher. So it is unaffordable for most small employers. Does that make sense?
Yep.
Okay, so now there's something called level funding, and this has been around for a couple of years as well, and it is the best of both worlds. You have a predictable fixed monthly payment, you have a cap on your financial responsibility, you have coverage for the claims run out, and you have integrated disease and wellness. On the self-insured side, you get a refund when your claims are lower than expected. You get reports so you understand what is happening in your plan. You've got flexible plan design, and in this particular situation, you've got economies of scale because you are part of AMI. Right? So you kind of lump all of that together and you get the best of all possible worlds. We call it the spectrum of employee benefits. and it's going to include all of the things that you need. So you're going to need, in addition to your plans, you're going to need a way to get it enrolled. You're going to need a little guidance on how to use it and make it all work. You're going to need compliance. We're going to talk about that in just a second. You're going to need some technology, and you're going to need communications. So I'm going to walk through all of those pieces with you, and then I'll be glad to answer any questions. I'm sure that there are going to be questions at the end. So the full spectrum of benefits is listed out here. So the core of that is the major medical and the healthcare supply chain management. All right, so those are all the tools that make the plan work in the most efficient manner possible. How we help support that is by using a benefits app that gives 24/7 advocacy for all members. So anytime somebody has a question, how do I get to a doctor? I don't understand my bill. What is my network? What are my choices for treatment? 24-hour option for that. So they can call at any time of day and a person will answer the phone and answer their questions. Telemedicine is included in that. You can access all of your benefit information. You can take a picture of your ID cards and they can live in there. If you've got any billing issues, they can all be handled by the 24-hour advocacy. Now, no longer is it sufficient to offer a medical benefit alone. So we've built everything else that you need around that. And that will vary, per employer. Some employers want this and not that, and some employers want that and not this. So if you need dental insurance, vision insurance, basic life, voluntary life, short and long-term disability, either employer paid or on a voluntary basis. If you need voluntary products, cancer plans, accident plans, critical illness plans, we can wrap all of that around. That is a choice as the employer that you make, and we'll set all of that up for you. So I'm going to go back to how a level funding plan works. And
Allison,
this is going to get
hang on for just a quick second. To our employees, though, this looks exactly the same, right?
It looks exactly the same. They're going to get an ID card and they're going to have a number to call.
Yeah, and when we talked before, what you said was, everybody will have a place where they can go plug doctors in and things like that. But
yes.
that what your experience has been is that 95% or more of doctors and hospitals accept this coverage, and if they don't, you guys will actually contact them directly and negotiate to see if they will accept the insurance, correct?
We will. Now, we don't want to do that. First off, the PHCS network is very rich, and you will find just about everybody you need in it. And we do want to do that on an exception basis. And really, it shouldn't happen very much at all. All righty. Any more questions right now?
Nope.
Okay. So this is what you're looking at right now is a really, as simple as I could make it, explanation of the components of health insurance. So for a fully insured or a self-funded or level funding plan, the components are the same, okay? Administrative expenses, stop-loss premium, that's that reinsurance or large deductible that we talked about before, and then the actual claims costs. When you're in a level funding plan, you're going to pay your set premium every month, just like you do on fully insured, and we're going to pay your claims as they go on. But if there's any dollars left at the end of the year, you can choose to either get those back or use them to lower your premium the next year. So that potential savings is insurance company profit. See how that works?
I do like that.
Okay, so this is what it looks like on a monthly basis. You have your claims fund, your admin, and your aggregate kind of stop-loss stuff, and you pay one premium. So you don't have any inconsistency month to month. I know as a small business owner myself, I prefer when I know what the expense is going to be, so you have that. So you don't have any unpredictability there.
So again, this looks just like how we're doing it now in a fully funded, for most of us, we have like a Blue Cross Blue Shield or something like that. This looks exactly the same.
It looks exactly the same, and it works better on the back end.
Right.
So let's talk about a couple of examples. And I've got sort of a small, medium, large here, and they are, of course, in reverse order. So the first one was a local county government, and They had 36 members on the plan. Their 2016 annual premium was $338, and their 2017 was going to be $382. So they moved to this, and that was on a fully insured plan. They moved to this plan. They saved 30% in cost. Their renewal increase was 0, and they had 65% participation in their wellness program. So the results can be pretty dramatic. And if you are a little bit of a different size employer, okay, let's do this one. This was an 18-member plan. Their rate increase has been pretty consistent in the 20s, and their rate increase for 2018 was predicted to be 32%. They moved from their fully insured plan into this plan. We increased the benefits, and we met the 2017 rate. And we added, for this particular employer, with the money that they saved, they added some benefits on an employer paid basis. And that is a choice that you make as an employer. You know, we make it available and you decide to handle that however you'd like to. For smaller employers, we just did one, and I don't have a lot of data on this one. It was an actual chamber, and this is usually where we offer this plan, is through chambers. This was the chamber staff, and they saved $1,200 a month by moving to the Medova plan, and their benefits remain the same, and they have a person with a diabetic child that they were spending about $400 a month on diabetic supplies. On this plan, they're covered at 100%. So it was not only a win for the employer, it was an incredible win for the employees. So the missing piece of this that we haven't talked about yet is called the benefits app, and I think it is it adds a concierge level of service to your plan that most employers don't do. And it will allow all of the questions about, is somebody covered and what do I do and how do we do it? That all gets out of your office and into your employees' phones, because literally they have access to somebody 24 hours a day. And the telehealth is on there as well. You will see and hear us talk a lot about telehealth as we engage and go through this process. Telehealth is a very inexpensive thing, and it will save you about $237 in plan cost and lost productivity per encounter. It's a pretty significant number. So if none of those claims, let's say that you have 5 visits in telehealth from your employees through the course of the year, that's $1,000 in plan cost that you're not spending. And then that doesn't go into your claims, and your renewal is flat or even can be reduced. Do you see kind of how that all works together? Can you hear me?
Yep, we're still good.
Okay, great.
I'm just letting the questions pile up for the end, so.
Okay, great. So then the last piece of this is the traditional benefits and the voluntary benefits. So we've got basic life in the plan that you can access, and basic life is the life insurance that you choose as an employer. So you pay for 10 or 20, or for us, we can offer up to $50,000 in employer paid life insurance. And you pay for that for your employees. We also offer voluntary term life insurance, and we have an offer of up to $100,000 in voluntary term life for the employee, with 50% for the spouse, and the usual flat amounts for kids. Kids are always flat amounts in their units. So if you have an employee that has 1 child or 10, it's always the same cost. If you need dental, there's vision, short and long-term disability payable on a voluntary basis, or if you as the employer want to pay it, we can do that as well. There are reasons to offer either, and that will depend on the employer. And then we do also offer a full suite of voluntary benefits. Those are the accident, the hospital, the critical illness. Those are the plans that are paid for by the employee. And then they're called scheduled benefit plans. If I have an accident, if I get run over by a bus, if I have a heart attack, if I get a cancer diagnosis, I file the claim with the carrier, and the money comes to me, and I use that money to cover either the out-of-pocket costs or time off from work or extra expenses, whatever it is that I need to do.
But I just want to be clear. The regular health insurance, like if I get hit by a bus and I have to go to the hospital, my regular health
Yes,
insurance covers that. Or if I get cancer or whatever, this is really
absolutely.
this is like an Aflac kind of plan, right?
It absolutely is. I've
Okay.
chosen a different vendor, but
Yeah.
yes.
Yeah.
All right, let's talk about compliance, everybody's favorite subject. So when you're in a self-funded plan, you do have to have something called an ERISA plan document. It's not difficult, it's just fiddly. So what we've done is make a plan document available to you at a very reasonable cost. It'll cost $375 for the setup. It will cover every plan that you're offering, and you have to answer a couple of page questionnaire, and each question is a multiple choice, and the question might be 3 per page. So it's nothing terrible. And some of that we will fill in for you. You send the questionnaire back, you send your check for $375, and they send you a binder book and everything that you need to be compliant. You need to do that once, and then you need to do that when the plans change, which hopefully won't be for a number of years. And that relationship is between you and somebody called the ETC companies. They do a great job. They're headquartered where I am in San Antonio. They normally charge $600 for this service, but they're charging $375 for the AMI Association plan. And then if you need anything else, they will discount their services for you. I don't think you will. Most small employers don't, but this you need to do. If we decide to work together on an individual basis, this is going to be one of the things that you're signing off on that you want or don't want. And you want this. It's simple, it's easy, and it gets you exactly where you need to go. All right, the last pieces, technology and communication. So we're going to use an enrollment platform. Some of you may use an enrollment platform now. Some of you may still enroll on paper. We're going to set this up on an enrollment platform. Your employees will log in. They'll say, I want this, I want that, I don't want this, this is my beneficiary, and I'm done. We get you the payroll deductions. We send all the data to the appropriate carriers, and you can get into that system, and your employees can get into that system throughout the year to look at what you have, or if you've got somebody that has a qualifying event and needs to change coverage, they can do that right online. So we've built that in as well. I want to talk a little bit about process and timeline. I know insurance is just a bear for people that don't do it every day for a living. We've done a lot to skinny it down and make it as simple as we possibly can. It's still not a really simple process. So I've got a timeline for you here. We also have a landing page that we'll talk about in a minute, and there is a full timeline and a checklist there. But so we're going to use this 40-day timeline. So we're going to start with an intro call. Then we're going to need the employee health questionnaires completed and a census and current plan and rate information sent back to us. We're going to send it to underwriting. As you see here, there's 14 days built into this. This time of year, we're going to need that 14 days. At other times of year, they will usually come back in about a week, maybe 10 days. But this time of year, we're going to need that 14 days. I'm going to give you
Allison,
a couple of...
can you explain how everybody gets underwritten as an individual company, even inside the group policy or plan?
Yes, so this is an association plan. So the underwriting concessions, meaning the internal setup of the plan, is the same for all of you. And it's very generous, and it's as flexible as it can possibly be. But since you are all your own individual employers and you're all going to want to offer your own plan and pay your own invoice, each group is underwritten with their particular employees. So all of your rates will not be exactly identical.
So the way we benefit though as a collective is, one, there's more discounting and flexibility to all of us in the initial underwriting, and then there's also additional shared cost savings and risk sort of spreading
Yes.
when it comes to renewal time.
Exactly. So
Okay.
the risk is spread among all of you, even though you're all individually underwritten. It's kind of like you have to hold two separate thoughts in your head about this at the same time. So, but that helps you stand on your own. And if you are a healthier group, your costs will be less. And if you are a little bit of a sicker group, your costs will be a little bit more.
But they'll be less as a group than they would be on your own in theory.
Absolutely.
Yeah. Okay.
Absolutely. So I'm going to give you a couple of days to decide, and then we're going to need a couple of days to make sure that everything is set up properly on our end. We're going to give you about 5 days to enroll. If I can make that window shorter, I will, but I think people need a little bit of time to talk and mull it over and think about it. And then we are going to wrap it up and submit everything where it needs to go. Because we've got all of these moving parts, we do like to have a bit of a window to make sure that enrollments get processed and you're active in the system, even if you don't get an ID card. Now, if we get your stuff submitted on the 15th of the month, you will have an ID card by the 1st of the following month. Particularly this time of year, I like that window. Just to make sure that everything is okay. This is not you've made a late renewal decision and you're staying where you are. This is you are changing what you're doing. So you need to get set up in a number of new systems. So I like the window, and it will make everything run a little bit smoother moving forward. All right, quick recap. The insurance is through Medova, and because we're in the insurance business, we could not possibly make it really, really easy. So the company is called Medova, and every piece of information you get about the plan is going to say something like, say that this is the lifestyle plan. That's what they're called. There's 16 plan designs. They range from $1,000 deductible to well over $5,000. So you've got some choice there. You do need to limit yourself to 2 or 3 depending on your employee size. And most of you will only have 2 or 3 choices now. And some of you may only have 1. PHCS is the network. You really should find most of your doctors and hospitals there. You are going to save money by the underwriting up front and spreading the risk and using the cost containment tools on the back end. That isn't something that you'll really see as the employer, but it is what helps you keep your premium consistent. This is no riskier to your business. You will know exactly what you're going to pay each month, and you'll go through a renewal process just like you do on your fully insured plan now. The administrative work should be similar. You'll have an invoice per carrier, and I'm going to strongly encourage the compliance setup. Rules of the road are the same. The minimum number of hours to work for an employee to be considered full-time is 30. I think most of you are probably at 30 or somewhere between 30 and 40 now. And you are each employer will choose their own eligibility period. So if your current eligibility is the first of the month following the date of hire, you can have that. If it's first of the month following 30 days, you can have that. If it's first of the month following 60, you can have that. Federal mandate is that your waiting period cannot be longer than 90 days. So you're going to need to be under that. Same rules apply. You will be able to you will choose as the employer which plans you offer, and you will choose the contribution strategy that works best for you. And you do not need to wait until renewal. You can do it now, you can do it mid-year, whatever it is that works for you. Take a look. The premium savings are usually substantial enough that it makes it worth your while to change. And next steps. So I'm going to want to talk to each of you because each of you are going to be a little bit different. We also have a landing page. It's at our main website, dipaliprofservices.com/AMI. You'll find the scheduling tool to talk to me. You'll also find the checklist that will walk you through each step. That checklist doesn't have dates on it, but it'll give you a good workflow as to what to expect. The health questionnaire is on there, and the census document that we need completed is on there as well. And if you have any questions, please don't hesitate to shoot us an email, and you are welcome to call us as well. Our phone number is on the landing page. It is 210-617-3086. You're welcome to call us anytime during the day, and we'll be happy to answer whatever questions you have. I suspect you're going to have a lot of questions. I know I do when I started this process. So,
All right, let's dig through questions. So I'm just going to take them from the top. Will both standard health plan and high deductible health plans be offered?
there are a couple of high deductible health plans. There are only ever a couple of high deductible health plans, and then the bulk will be standard health plans.
Is there a minimum of number of employees that you have to be in the plan?
This will go down to 2. We've just done one with 5. The bulk of what we do is usually in the 10 to 50.
Okay.
So no, it can be whatever you need it to be.
Okay. What if the claims are higher than the total premiums paid?
So remember when I talked about that specific or employer deductible? So once that's what you're responsible for. Once you hit that, then the reinsurance kicks in and you are not responsible to pay any additional. If you have a terrible, terrible year, you will have a rate increase, just like you would on a fully insured plan, but you'll know what it is. And usually it's a little bit less than on a fully insured plan because your risk is spread around.
Who is the TPA and what is a TPA?
A TPA is a third-party administrator, and they administer your plan. So they're responsible for making sure that people are enrolled and doing pre-certs and verifying coverage and engaging with the wellness plan and all that kind of stuff. Medova is the TPA.
Okay.
And then the plans are called the lifestyle plans.
Okay, so my agency is on the open market for our major medical health insurance. We pay a flat fee per employee towards their premium. We do have a fixed bill each month. Am I correct that these are savings for companies that are fully funding themselves? And would this not apply to us? I think the answer to that is no, right?
I think that answer is no. What I got from that is you're offering that employees are on their own plans and you're just paying a set amount.
Leslie, is that correct? So everybody is basically on open enrollment and you're just giving them money towards that? Okay, I'm just going to keep clicking through and we'll come back to that question.
If that's the case, then no, because everybody has their own. There is no group plan. This is a group insurance, employer-sponsored insurance plan.
Okay. Are the claims analysis based on employees or their families?
Both.
Okay.
Anybody covered.
Okay. So Elton, it sounds like you're going to want to talk to Allison about that. Talk about HIPAA portability and whether this protects you from going back to a group plan.
What do you mean if it protects you from going back into a group plan?
So Michelle, what we need more information.
So
go ahead, Allison.
So this is just another group plan. So if you're with this for a couple of years and it no longer works for you, you can go back to a fully insured or anything else that works for you. There wouldn't be any difference than if you went from Aetna to Humana or Aetna to Cigna or, Cigna to United.
Okay. So someone says, so does telehealth replace an office visit?
Generally, it's not going to replace an annual well visit, so an annual exam or anything like that, and those are still covered at 100%. What it should replace is it's 10 o'clock and I have a sinus infection and I didn't get to the doctor during the day. So you call the telehealth, you get your sinus, you get your prescription for your sinus. My child is vomiting at 3 o'clock in the morning because that's a law that children only vomit at 3 o'clock in the morning. And I don't know if I'm in the state yet where I need to go to the emergency room or I should wait and talk to my doctor in the morning. You can call telehealth and speak to a physician who will help you make that decision. Or I've injured myself, but I'm maybe not really sure how seriously I've injured myself. Minor things that need attention, but are not all that serious. Or you don't know if it's all that serious.
It's like one of those call a nurse programs, only you actually talk to a doctor who can prescribe medicine and can also help you triage and make a decision about should you go to the ER or should you wait and go to the doctor in the morning or something like that.
Yes.
Cool. Okay.
I love telehealth. I use it every time I get a sinus infection. I am a grown person. I understand what a sinus infection looks like. I call, I've got this. Oh yeah, sinus infection, here you go. And
Right.
I get my medicine and I'm good.
Yeah. Does the cost for dependents or kids vary based on their ages?
No. It'll look just like a family rate that you pay now. For most employers, you have employee, employee spouse, employee child or children, and then full family. You would see a similar rate structure.
Okay. We're in our second year with Aetna Funding Advantage self-funded plan. We get stopgap reports every month, and we got a few $1,000s back last year. This sounds like what we've signed up with them. How is it different?
It's different. So one, you're already used to the process. So that's great. And I like that, by the way. What this plan will offer is the cost containment tools that will actually control the expenses. Aetna doesn't do that.
Okay.
So that would be the difference. The difference should be invisible to you.
All of our employees must complete the questionnaire individually. Is that correct? The census question, right?
The census document is for the employer to complete, and that is, who are your employees and how much do they get paid and what is their date of hire and their date of birth, and the information that you have. The health questionnaires are completed by each employee. They can be sent back to us directly. You don't need to look at those, or you can batch them back to us. Whatever is best for your particular office is fine with us, and then we submit those to underwriting, and that's how the case gets rated.
Okay. Does it matter if some of our employees are also family members?
It shouldn't, unless you're an employer of two. Then, depending on your state, it can be a little tricky.
Okay, so again, we'd need to have a conversation with you about that.
Yes.
Okay.
And family members, I mean spouses, parents and grown children, that's absolutely fine.
Okay. The plan, so if somebody wanted to go and plug in their doctor's names, is there a place for them to do that?
Yes, I'll get the name of the network up on the landing page, but it should be phcs.com.
Okay. But the plan name is Medova PPO, or is it something different?
It's just Medova. And then the plans are all the lifestyle series.
The lifestyle series.
And you'll see that on all the material that you get. It'll say lifestyle series across the top. There are 16, so there are good choices for whatever direction of coverage you would like to go in.
Okay. A lot of our claims are prescriptions versus regular medical. Does that affect our rating?
Absolutely.
Okay. Is there an HSA option?
I believe there is an HSA. Yes, there is an HSA option. The high deductible health plan will allow that.
Okay.
And then we can set that up for you. And if you already have individual HSAs set up, they don't need to be disturbed. You can just keep what you've got.
It's been mentioned that the average savings is about $1,500 per employee per year. What things do you do to achieve that versus what a traditional carrier may do?
So we make sure that, one, you're getting your preventive care. So there's some wellness in here. We do cover diabetic supplies at 100%. So if you have an employee or a dependent that is diabetic, those supplies are going to be covered at 100%. We also have built in some cost containment tools, like the one I showed you where you saw the difference in cost between the places to get care. If a pre-cert comes for a knee surgery and it's at an expensive location, Medova will reach out to the employee and say, hey, we understand that you're getting your knee replaced and we've got you pre-certed and ready to go. Would you consider going to this particular facility instead? It's within travel distance from where you are and they have better outcomes. What we're not discussing with the employee is that knee surgery may cost $30,000 and not $70,000. And obviously, it is an employee choice.
And obviously, if it's worse outcomes, then you're just not calling them.
Correct.
Yeah. Okay.
We're only sending to where there is a better outcome.
Got it.
And it is also an employee choice. You cannot force an employee to do that. But what that does for you as the employer is if the employee says, oh, okay, I'll go there, then rather than your group of employees having and let's say there's no other claims, $70,000 in claims, you have 40 or 30. Knees can vary $30,000-$40,000 depending on the facility. That's fairly typical. Any surgery like that that can be planned, there's huge discrepancies in cost between facilities, and truly the high quality facilities are almost always less expensive.
So someone's saying, how does this compare to an HSA? But an HSA is just a component of how you pay for it, right?
Correct. So if you want to have an HSA, and I had to part with mine this year and made a mighty big stink about it. If you have an HSA, then you just have to have a high deductible health plan. So the HSA is just a savings vehicle for you.
Okay. So we've already talked about HSAs. Are HRAs available with this coverage? What is an HRA?
An HRA is a health reimbursement arrangement, and yes, we can set up an HRA for you. And if you have one in place already, we can amend the documents.
Okay. So back to the agency that everybody's on the open enrollment plan, so they just get a flat fee. So her question is, so would this be more expensive for Cone? Well, it's a different. First, I will let you answer this question, but it's a different thing. It's instead of saying, hey, you have to go shop for your own, what you're saying is, look, we've got a group health plan, and here's what it is, right?
Correct.
But in theory, if they're only paying $225, well, you probably can't answer this until you see a census, right? If it would be more expensive.
I can't answer it until I see a census. I will caveat that by saying, if you're paying $225 a month, your employees are paying a fair chunk out of pocket themselves for the premium, most likely, and we're not going to get to $225 in premium. But it doesn't mean we won't save people money in the whole, if that makes sense.
Yeah. So somebody's saying, is this through a brokerage firm? I don't think so.
Well, I am the advisor.
Right.
So I act as the advisor.
Are you protected under HIPAA portability? Is this considered a group plan? We've already talked about that,
yes,
right?
Yes, it is.
Yeah. Is there a provider search? Yeah, we've already talked about that. There'll be a link on the landing page. What states are excluded? So there are some states that are more problematic than others, and we're still trying to figure out how we can help them. The ones that are going to be most problematic are going to be California, no shocker, Florida, Delaware, North Dakota, and Maine. So we're working on workarounds. Allison is saying that some states there won't be a workaround, so we're just going to have to make a referral to a better option for you inside your state. But we're still trying to solve that problem.
And I want to add that if you're situs in not one of those states, but you've got somebody in California or Florida or Maine, as long as you're situs in a state where the plan is valid, that's fine. So like if you're situs in Texas and you have 2 employees in California, that's absolutely fine. The rules of the state of Texas apply.
Okay. So people are already trying to look up their plans, which I knew they would. They should just wait until you give them the link, because it's not going to be listed as Medova, right? It's going to be listed as something else.
You're not going to find it. You're not going to find it.
So just a little patience, folks. Does telehealth have access to your health history? I would think so.
No.
Can you explain in a little more detail the cost containment tools?
Sure. So we have, this plan uses something called a fiduciary PBM. And remember when we talked about that metformin example? So what a fiduciary PBM does is make sure that there's no spread pricing, because in theory, 1,000 milligram dose of metformin should, on a monthly basis, should be $13, not $7,000. If 500 is $650, then 1,000 should be $13. There might be a little bit higher or lower or whatever, but it really should be right in that neighborhood. So the fiduciary PBM makes sure that you are getting the best possible price so that the plan pays the lowest possible price. So there's no spread pricing. That's a big one. We also make sure that you're getting those medications at the best cost. And we do cover the diabetic supplies at 100%. That can help people tremendously. The reason that they do that is that the plan, that over time, the goal is that a person with diabetes is in as good a health as possible, because a person with diabetes that's in good health is really not very expensive. It's some money for the supplies and the medication and the annual checkups, and there should be several. You know, your primary care, your endocrinologist, you should get your eyes checked, and you should get your teeth cleaned. And those things are not really expensive, right? But if you have a person with diabetes that doesn't take their medication, that can be a $40,000 emergency room visit. You don't want that. So there's a big focus on making sure that people with chronic conditions are taking their medicine and can pay for their medicine, because a lot of people can't afford $30 a month for 4 medications. So you want to make sure that you've got a plan that gets the lowest possible price and make sure that the member and the plan pay the lowest possible price. I know I sound like I harp and harp and harp on this. It's a big deal. It drives a lot of cost. The other thing that they do is make sure you are at a high quality facility, and they use some repricing tools to make sure that they pay the best price and not, 300 or 800% of Medicare. They work to make sure that they're paying 200% of Medicare, which is twice what a facility receives when they take care of a Medicare patient.
And again, this happens all behind the scenes, and
all behind the scenes.
Yeah, right. Okay.
So as an employee or an employer, you really won't see this.
Yeah. So I'm skipping any questions about specific what doctors that take it. We'll get you the landing page where you can search for all of that when we get off the call. Were there concerns about specific states' coverage under the plan since we're a dispersed team? No, it just depends on where the business is located, right? So whatever state you claim as your home state, as long as it's not one of the ones I listed, you shouldn't have any problem. So if you're a virtual agency, this should not be a problem for you. But wherever your mailing address is, that's the state in which coverage is going to sort of originate from, if you will.
Correct.
What happens if underwriting declines a high-risk individual in our group?
There is no declining of high-risk individuals. Your rate might be a little bit more. There have been instances with very small employers. If you have 4 or 5 employees and you have 3 smokers and 2 diabetics, this might not be the plan for you. Let me be very frank about that.
Simply because it may not be a cost savings, is what you're saying.
Correct.
Yeah.
There will most likely not be any cost savings here. So this may not work for you. That really is the challenge that we've seen is when you have much smaller employers and when they're a very sick group. And I don't mean that in a derogatory way. It's just that's kind of what we call it, in the industry. Apologies.
Okay, can you tell us a little more about the prescription coverage? Is that something you can get into quickly?
Sure. That is not a simple subject, and that might be a conversation that we would want to have on our one-on-one calls. It does have a prescription plan, and there are copays, and from a user perspective, you would go to the pharmacy just like you do now and get your prescription and pay your copay. What is different is the back end and how much the plan pays for that prescription.
Okay, we've already talked about flexible spending accounts, so got that one. So if we submit the employee census, state the desired coverage, then we can get a firm quote on what the plan would cost. That's correct, right?
That is correct. It is taking us a little more than 10 days right now in the beginning of November to get those quotes back because they're all underwritten. So please build that into your timeline. If you want to be covered effective January 1st, our conversations need to happen soon.
Okay. People have to actually have their employees fill out the questionnaire. You can't do rates just off a census. Is that correct?
No, not on this plan. And most of you are used to doing just the census and getting a rate. This works a little bit differently. This is looking at your case specifically, so we need to know what's going on there.
And then somebody's saying, how are you getting the prices and quality ratings of the different hospital systems or doctors or whatever it is you get?
So there are rating systems, right? There's probably about half a dozen of them. And we use a tool that aggregates all that data.
Okay.
So you see where the outcomes are and what facilities are rated highly and what are not, and what they cost.
Okay. If the employee chooses the other hospital, I guess this is going back to your knee replacement example, to get their knee replaced and they have to travel, does the plan pay that cost? Craig, are you talking about the travel cost or the hospital cost? We would pay the hospital cost. It just may or may not pay the travel cost, right? Yeah. What are the typical rate increases you're seeing annually?
We're seeing a couple of percent, and sometimes we're seeing flat. We're not seeing huge rate increases.
Are you seeing double digits?
No.
Oh, that'd be beautiful. Somebody says, so if I have a kid who goes to school in North Dakota.
That's fine.
Okay.
It's not, so the problem is, so I'm going to talk insurance ease for a minute.
Yep.
So self-funded plans are called ERISA plans, and they are not regulated by the states. Level funded plans fall a little bit not regulated by the state as well, but the states can apply some control measures. And let me give you an example, and I'm going to pick on California. In California, the minimum specific deductible that an employer can have is $40,000. That is probably too much exposure for just about everybody on the call. So it's not, so we can't even offer a self-funded plan because it would make no sense for you as the employer. You don't want to be on the hook for $40,000 of anybody's claim. Not that it doesn't happen very often. It happens to 2% of the population. You still don't want to be on the hook for that. So California is a state that has very, very, very little self-funded plans. Generally, they're for much larger organizations in the 250 plus life that will tolerate that.
But you could explore that with somebody and see if it made sense for them. That's what you're saying. So
I will happily talk, and we can figure out a way to get them what they need.
Yeah. Okay, somebody's asking, this is a question for me, not you. What is the AMI eligibility requirement? You have to be in an active network with the associated fees. Yes, that's correct. So to be considered part of the association, you actually have to belong to the association, which means that one of the legal requirements that we have is you have to pay membership dues to be considered a member of the association. So if you just go to our workshops or things like that, you're not eligible.
Correct.
Yeah. Does the plan offer mail order pharmacy options like a 3-month prescription and cost savings?
Yes.
Has AMI decided where they will enroll in 2019? I don't understand that question, Jenny. Anybody have other questions? Okay, I'm going to leave this screen up while I wait to see if you have more questions. Oh, I see what you're saying. Are you asking if my employees are going to be doing this? Is that what you're asking? Well, we're going to go through the census. If it saves us money, then yeah, of course we will. All right, here are the landing pages. Who is the reinsurance carrier?
I will get that for you. That is probably split up among a couple of reinsurance carriers.
Okay. So somebody said, I'm in one of the trouble states. What are the next steps? Yeah, your next step is to schedule a call with Allison and see what we can figure out for you. At the worst case, she'll give you a referral to somebody inside your state who may be helpful. If this plan if we can't figure out a workaround to make this work for you and your state, at the worst case scenario, Allison will connect you with somebody who will help you within your state to try and find a better option. But first,
Yes.
obviously, we'll try and see if we can make this work for you. All right, so here's the plan, you guys. If this is of interest to you, you need to go to the landing page and schedule an appointment to talk to Allison. You can also fill out the census document, get your folks to fill out the individual questionnaires, and that's how you're going to get a firm bid. So, can we see the outline of plans before the questionnaires are filled out?
I will, yes,
Can
I
you
will
add that
get
to
them.
Can you just add that to the landing page?
I don't think I want to add those to the landing page. I will get them to you.
Okay, sounds good.
The landing page is public, so.
Okay, all right, yep. So if you want to outline of the plans, shoot me an email, and once I get them from Allison, I'll get them to you. Other questions? All right, hopefully this was useful. I'm hoping that this will be a good cost-saving solution for many of us. So my fingers are crossed on that. And we will know as we start having those conversations with Allison. So do not dilly or dally. Book your calendar appointment so you can start the process if you want to switch over in January. All right, any more questions? All right, thanks for your time and your attention. I will also send out a link where you can watch the video and you can show other folks the video inside your team, and then fire away with questions. Not to me, because clearly this is not my area of expertise. Reach out to Allison and ask her all the questions that you have. She's very responsive. She wants to be a good resource to you, so do not hesitate to schedule some time or shoot her an email with questions. If you're going to email her, make sure that you identify that you are part of AMI, because otherwise she won't know who you are. And obviously, I wouldn't be sharing this out to people who are outside of the networks because they're not eligible. So I prefer you not talk about it unless you're saying, hey, you should join AMI because you can get this healthcare plan. But other than that, it's not something we can offer to everybody. So it's our little secret. So, all right. With that, I don't see any more questions. So Allison, thanks for your time. Appreciate it.
Thank you.
And
looking forward to talking to you all.
All right. Talk to you guys soon.
Thanks.